So I'm going to speak to you today as a student, as a teacher, and as a GP. I'm going to start with a little story about a man who I met in clinic about 4 years ago, a man called James. He was about maybe 56, 57 years old, and he had suffered a stroke. And he had been admitted to hospital for a period of time. And when he was in hospital, he lost his accommodation. He'd lost his access to what we call the medical card here. So low-income patients here can apply for what's known as a medical card to get government-provided healthcare, but he'd lost that because he hadn't responded to letters because he was in hospital, and he'd also lost his state income benefits because he wasn't replying to letters or collecting his money. So naturally he was pretty upset, pretty despondent. So when he had come to me, and he also had a long list of medications that he was being asked to take after a stroke for secondary prevention and for COPD. He couldn't afford those, and he also couldn't attend any of the multidisciplinary stroke rehab that was being offered to him, that's evidence-based and internationally proven to be really, really important post-stroke. So this was Limerick, this was Ireland, this was 2014, and this was the situation we were faced with. And it's just an example highlighting, I suppose, the vulnerability and difficulties that certain people in this city here were facing and are facing. So what did we do about it? I suppose first of all, it does kind of, it's a living embodiment of what Julian Tudor-Hart, who's recently deceased, talked about the inverse care law, so the availability of good medical, decent quality medical care being least available to people who need it most, and John's case is a really hard example of that. So what did we do about it, or what did we come up with? So at the time, it was. Oh, I'm sorry.
You can press the button down here.
Okay.
Yeah, use this.
So what did we do? So a group of stakeholders came together, and it was the HSE, which is our version of the NHS, which is the healthcare funders and providers, came together with a general practice vocational training scheme, the ICGP, which is our college for general practice education, the graduate entry medical school here, and came up with a plan around research teaching and service provision if needed. But the most important group in this was actually socially excluded patients themselves, their advocates, their families and agencies in the city. So what we did was we developed a clinical service, and I'm delighted to say that over the last 4 years, that clinic, running approximately one afternoon a week for the last 4 years, has engaged with and worked with almost 700 patients in a variety of ways. And this is a picture of my runners, which have since been binned because they have holes in the bottom from literally running around the streets of Limerick. And that's just a reflection of the adaptability and the approach that we have to take when we are engaging with communities. And I think my time is up. Thank you.